Introduction to Epidemiology. Meaning of epidemiology. Epidemiology is the scientific study of how diseases and other health conditions are distributed among populations and the factors that influence their occurrence. Epidemiology is the study of the distribution and determinants of health-related states or events in specified populations, and the application of this study to control health problems. In simpler terms, it seeks to understand who gets sick, where, when, and why, and then uses that knowledge to prevent illness and improve community health. Importance of epidemiology in environmental health. Epidemiology is often called the foundation of public health. For environmental health professionals, it provides a scientific basis for identifying environmental causes of diseases and developing control measures. Its importance includes understanding disease patterns. Epidemiology helps determine how diseases occur and spread within a population. Example: studying malaria distribution in areas with poor drainage or stagnant water. Identifying environmental risk factors. It reveals links between environmental exposures and health outcomes. Example: tracing cholera outbreaks to contaminated water sources. Guiding disease prevention and control. Findings from epidemiological studies support the design of preventive measures such as sanitation, vaccination, and vector control programs, health planning and policy development. Data from epidemiological surveillance help government and health agencies set priorities and allocate resources effectively. Evaluation of health programs. It measures the impact of environmental health interventions, such as waste management, water purification, or hygiene education on disease reduction. Research and innovation. Epidemiology stimulates further investigation into causes of emerging health issues like air pollution, climate change, and zoonotic diseases. Practical example: during a cholera outbreak, epidemiology helps environmental health officers identify who is affected, age, sex, occupation, where the outbreak occurred, community or water source, when it started, season or event, why it happened, contaminated water due to poor sanitation. By analyzing these factors, appropriate disease control actions, such as water chlorination, sanitation enforcement, and health education, can be implemented effectively. Conclusion: epidemiology is a cornerstone of public and environmental health practice. It provides the knowledge, methods, and data needed to understand disease occurrence, detect outbreaks early, and guide preventive actions. For environmental health students, mastering epidemiology is essential for promoting community health, preventing environmental diseases, and achieving sustainable health development. Importance of epidemiology. Epidemiology is often called the cornerstone of public health because it provides the scientific foundation for understanding diseases, preventing their spread, and promoting population health. Below are the key reasons why epidemiology is important. Identifies the causes of diseases. Epidemiology helps determine what causes diseases, injuries, and other health problems. Example: investigating how contaminated water leads to cholera outbreaks, or how smoking causes lung cancer. Describes the pattern of disease. It helps to describe who gets sick, where and when diseases occur. This understanding, person, place, and time helps in identifying at-risk populations and planning control measures. Example: tracking malaria cases across different seasons and regions. Guides. Public health policy and planning. Epidemiological data inform decision-makers about where to allocate health resources effectively. Example: using disease surveillance data to plan vaccination campaigns or build healthcare facilities in high-risk areas. Evaluates public health interventions. It assesses whether health programs and policies are effective. Example: measuring the impact of a mosquito control program on reducing malaria cases. Prevents and controls disease outbreaks. Epidemiologists detect and respond to disease outbreaks early, reducing their impact. Example: rapid response to Ebola, COVID-19, or cholera outbreaks to prevent further spread. Promotes health and well-being by identifying risk factors, like poor sanitation, unhealthy diets, or unsafe water. Epidemiology helps promote healthier lifestyles and environments. Example: encouraging hand washing and proper waste disposal to prevent diarrheal diseases. Contributes to research and medical knowledge. Epidemiological studies provide evidence that supports medical discoveries and innovations in treatment. Example: clinical trials and cohort studies used to test new vaccines or drugs. Protects future generations by learning from past and present disease patterns. Epidemiology helps predict and prevent future health problems. Example: monitoring antibiotic resistance trends to protect future populations.
Thank you for listening